and welcome to our special show, Living Long and Healthy with COVID Vaccination. Now, as India is in the grip of the second wave of the pandemic, the only way we can defeat this disease is through vaccinations. Only if more and more people are vaccinated will the virus circulation in the population go down. Now, on this show, we're going to try and address any concerns and questions that you may have regarding the vaccinations. I'm Gargi Rawat. To answer your questions on this show, we have with us Dr. Professor S.K. Wangnoo, Senior Consultant, Endocrinologist at the Indraprastha Apollo Hospitals in Delhi, and Dr. Praveen Chandra, Chairman, Division of Interventional Cardiology at the Medanta Heart Institute, New Delhi. Thank you so much, doctors, for taking time out for our show and answering all our questions. Dr. Wangnoo, I'd like to start with you. Now, we've heard that the Sputnik vaccine has been approved in India, and so far we've only had these two vaccines in our kitty. Can you tell us something more about the Sputnik vaccine and how it compares with the vaccines that are already available?
Yeah, let me first start praying to Almighty for the well-being of the human race in this unprecedented crisis, what we call COVID-19 tsunami. Yes, Sputnik V, what we call the Russia Sputnik V, is the third vaccine which got the DCGI approval on 13th of April this month. You know, this is a viral vector vaccine which utilizes cold virus to deliver small fragments of the coronavirus spike protein to the body to initiate an immune response against that. Number two, the Russian RDF, Russian Direct Investment Funding Agency, has collaborated with the Dr. Reddy's laboratory to roll out at least 250 million shots of Sputnik V vaccine by the beginning of the May or during the month of the May. And they are also collaborating with the six major pharma companies. You know, as per the phase 3 clinical trial, which were top-line results, which were out in the February this year, the Sputnik V vaccine has shown an efficacy rate of 92%. The Sputnik V is going to be having a tough, competition with the other two top players of the vaccine, which are basically mRNA vaccine. So this is the story right now for the Sputnik V vaccine.
Dr. Chandra, one of the questions everybody, keeps wondering about is the second wave of COVID has hit us, as Dr. Wangnoo described, like a tsunami, and the courts have also called it a tsunami. But your views on the cause, and also, we hear this talk of variants. So are the symptoms this time around different from the last time?
That's a very good question that you have raised, and because everybody is wondering at what is the cause? Why did it happen? So let me explain to you that this was expected. This is known historically also, and that has been seen in the last Spanish flu, which was 100 years back. The second wave was the most severe wave. And in most viral infections, this is the kind of wave pattern which happens, that the first wave is smaller, the second wave is much, much bigger, and then there will be a third wave and maybe a fourth wave. So why did it happen? Now, here there are multiple factors. Of course, we know that a lot of political discussion, debate is happening, whether the elections caused it or the rallies caused it. So it is not only one single factor. These are multiple factors. So did elections and rallies cause it? Yes, of course they did. But also the public functions like Kumbh Mela, like weddings, like people getting much, much lesser in terms of using the masks. The mask usage was absolutely not correct, and people were using the mask much below the faces. And so all this came together to bring this second wave. Now the second part is, what are the symptoms? So the symptoms this time are that patients are developing initial 1 week of mild symptoms, and generally the exacerbation or the increase of breathlessness, cough, fever happens at the time of about 7 to 10 days. And that is the time when these patients become very sick, and then they need to get admitted as soon as possible. And then it takes about another week for these patients to get better with the help of medications, sometimes oral medications, tablets, or at times they have to also, about 20% of these patients need admission for intravenous medications.
Dr. Wangnoo, this time around we've also been hearing a lot about, children, younger people and women getting infected in the second wave of COVID. What do we know about this? Why are we seeing this happening this time around?
My experience is this second wave, which is affecting more of the children, smaller children and women, primarily maybe because of the mutation. Double mutant virus of B1617 variant, where we have found two mutations, they affect more seriously the children basically. That is one thing we are seeing, this double mutant virus affecting the children more rapidly. And that is why the second thing what I am aware that children who are getting very mild symptoms, as Dr. Chandra told, were complacent about adhering to the COVID protocol norms as compared to the adults. Third thing, are we ready to tackle this increase in the incidence in the children and women? What I see is that last wave, the first wave affected only 1% of the children. And this second wave, what the recent data is showing, that around 1.2%, more than the last wave, are getting affected with the double mutant virus. So we have to be ready with the vaccination, with the government rolling out vaccination for all patients above the age of 18 years. And I am happy to say you, the Pfizer recently, a week back, announced their top-line results of 100% efficacy of their mRNA vaccine in children between 12 to 15 years of age. This was only last week top-line result. And the DCGI has also approved the Covaxin above the age of 12 years and the Covishield above the age of 18 years. That is number one as regards the children. We are happy that the government initiative to include the children about the vaccination schedule is a very good move. The Pfizer has started now going the phase 1, phase 2, phase 3 clinical trial for children between 6 months to the 11 years. The phase 1, 2 and 3 clinical trials are going on to see the efficacy of the vaccination among the children more than 6 months up to 11 years. So we are going to face, I don't know what is store in our future, that more and more children might be getting. We have to be ready.
Dr. Chandra, if we talk about patients who are currently suffering from COVID or, are going in for the vaccine, should they continue with prescribed heart disease medications?
So again, this is very, very important to understand that those patients or those people actually to start with, those people who are heart patients or receiving blood thinner medications, and there is a lot of myth about this that they cannot undergo a vaccination. And many times when they go to vaccination center, they are told that you are taking heart medicines, please ask your doctor. So let me now clarify this to everybody that there is no need to stop the heart medications or the blood thinner medications when they are going for vaccination. They can very, very safely undergo vaccination. They don't need to stop any medicines, and they don't even need to talk to their heart specialist to get a permission to get a vaccination. So vaccination is safe for heart patients. Vaccination can be done despite he's on blood thinners, and that is the current status. Now the second thing is that when they get a COVID infection, somebody gets a COVID infection, and also he is a heart patient or a blood pressure patient. So what medicine should be continued or should be stopped? Now, here I must tell you that these heart medicines are preventive for occurrence of clot formation inside the body, which is very common in COVID patients. So, which means that they must continue their blood thinner medications, which will make the COVID situation much safer in case they are getting they have the infections.
Dr. Wangnoo, is vaccination safe for type 1 diabetes patients and those with comorbidities like a history of diabetes complications?
Let me first clear that both type 1 diabetes and type 2 diabetes have equal chances of increased vulnerability of the diabetes-related complication if they get the COVID infection. That is why with the recent meetings by the CDC, they have really written that type 1 diabetes patients should be given the same prioritization as regard to the vaccine schedule as we are giving to the type 2 diabetic patients. So nowadays, that it is very safe for all the type 1 diabetic patients to undergo vaccination. It is very clear. Second important thing is that the comorbidities like hypertension, obesity, cancers, chronic pulmonary lung disease, chronic kidney disease, all these patients who are having comorbid conditions should be highly prioritized for the vaccination schedule, even if they are either having type 1 or type 2 diabetes. All the ICU data was showing that the mortality was high in patients with the hospitalized patient with associated comorbid condition. So my takeaway message is that vaccinate all people.
Dr. Chandra, now another of the questions that we get a lot from our viewers are whether, both the vaccines in India are safe and effective, and also should one choose between the two vaccines?
That both these vaccines are absolutely equal, they are equally safe, and they are equally effective. So there is no need to choose between the two. And many a times when patients ask me, which one should I take? So I tell them, Mr. Modi took the Covaxin and I have taken the Covishield, so you can choose between the two. So basically there is no difference. It is absolutely safe to take either of them, and there is no problem at all. Now the only thing, that initially why this confusion started, that, there should be anybody who's on blood thinner should avoid taking this vaccine. Actually, Covaxin, in its initial, that leaflet which came with the vaccination said that there should be some, one should consider that, whether the patient is taking blood thinners or not. So that was only a kind of a flag which was raised. Otherwise, there was no contraindication and there was nothing to stop that Covaxin cannot be given to patients who are taking blood thinners.
Right, so the message is to just go ahead and get vaccinated. Don't worry about which vaccine you're getting. Well, with that, time for us to slip into a short break. We'll be back with more. Welcome back to our special show, Living Long and Healthy with the COVID vaccinations, where we're answering all the questions and any concerns you may have regarding vaccinations, because remember, that's the only way we're going to get out of this pandemic. And now I'd like to ask a question to Dr. Wangnoo. If you could tell us what, according to you, is the ideal medical treatment protocol to be followed, when to isolate at home, when to quarantine, and what is the stage when you know that you must rush the patient to hospital?
I think this is a very important question, because what I am seeing over the last in my clinical practice, that everybody is following different guidelines. That is number one. People are getting panicky. People are rushing to the hospital. So I must tell to the listener that categorize yourself in the mild, moderate, or severe illness. The day you start having symptoms like upper respiratory tract infection, or you are not feeling breathless, and your saturation is normal, just isolate yourself. And if you have got a mild fever, take simple antipyretic like paracetamol. Hydration is important, and if you are having some bad cough, you can take antitussive. Now coming to the treatment, in this initial mild cases where the patient is not breathless, patient oxygen saturation is normal, only is having mild symptoms, there is some recommended treatment which can be followed, which everybody knows, that you can start with ivermectin or a short course of antibiotic, which may be doxycycline or azithromycin. In case of moderate, where your respiratory rate is more than 24 and the oxygen saturation dips to below 94, then there is a need to take hospital admission for oxygen support. In severe cases, when the patient oxygen saturation dips below 90%, the respiratory rate is more than 30, he requires immediate intensive care in a hospital, because you have to use non-invasive ventilation, you have to flow high flow nasal cannula, patient has to be given again IV Solimedrol injectable steroid, antibiotics to correct underlying lung infection, do certain blood tests including inflammatory markers to see the response of your treatment. And there is a very limited role, I must say. Again, there is a very limited role of remdesivir and tocilizumab. Remdesivir is basically indicated within 10 days of the start of the symptom, not after the 10 days. I will say within 9 days. Coming to the tocilizumab, that is again only indicated in severe cases when all other parameters fail.
Right. In fact, I want to ask more about these, medications that are being used. And, Dr. Chandra, right now we're seeing a lot of people in a rush, very, hysterical, trying to get their hands. And one can imagine, one can empathize with them if, you have a family member who is unwell and the doctors are telling you to get remdesivir or tocilizumab, and you feel that could be the only thing that could save them. But tell us more about this, because a lot of, we know that WHO has removed remdesivir, and we know that a lot of countries abroad don't use these drugs. So if you could explain it to us.
Yeah. So, this is a very, very important aspect of our discussion today about the use of remdesivir and the use of tocilizumab, which is a drug which is used in moderate to severe cases. As Dr. Wangnoo already mentioned, that remdesivir is of no use when the patient is beyond the first 10 days of his illness. So from the first onset of disease, not from the onset of the report of COVID positivity, we consider it from the first symptoms. So which means that after the 10 days, it is definitely of no use. And many times when the patients become sick and when they are beyond 10 days, people are rushing to take remdesivir. Let me tell you, there is no use to give this drug. It is coming out so expensive. Many times it is coming from the gray market. And then, of course, it is a useless medication to be given to those patients. But the second is the use of tocilizumab, which is another anti-cancer medication. It is actually an anti-cancer medication. And there are two more anti-cancer medications which have been studied for the treatment of COVID, because many times this tocilizumab, which was quite popularly used, is not available anywhere in the country. So, and then there were two studies which were done with bevacizumab, which is another anti-cancer medicine, which is available freely. It is not so expensive and can be used in these patients when the oxygen levels are falling, when these patients are not responding to the steroid medications, and they are in this phase where if we give this medicine in the first 24 hours, they have seen in the studies that the need to get a ventilator reduced. So it can be done to these patients, but certainly only to those patients where there is no super added infection, no bacterial infection, the liver is okay, the kidney is okay. Only those patients can be given this medicine, and it can help in that particular situation.
Right, and I think more and more doctors also need to be aware, it's in towns and, rural areas as well, not to just recommend these medications. Dr. Wangnoo, one last question. We have time for just one more. Is the vaccination safe for pregnant women and lactating mothers? We do know so far, I think they're not included in those who can get vaccinated.
Although very limited data are available for the safety of the use of vaccination in the pregnant females, but nonetheless, the pregnant females are more vulnerable to the severity of the COVID infection they get it. And in fact, some of the vaccines like Covishield has been reported to have no adverse pregnancy-related outcomes when they were given this vaccination. So, and also the RNA-related vaccines has also been found to be safe because they don't interact with the DNA, the genetic material of the mother. I have told you there is a difference in the immune response in the pregnant female. Second part of your question is lactating mother. So again, in the lactating mothers, there are the very limited data, but it has been shown the attenuated vaccines are safe to be given in lactating mothers, and they have shown that it doesn't cause any harm to the baby because they are getting breastfed, and these inactivated vaccines can be given to the patients who are lactating.
All right. Well, thank you so much, doctors. And I hope that helps our viewers in this time when we're in the midst of this pandemic. And again, I'd like to reiterate the message from all of you is to go and get vaccinated. The vaccines are safe. If you can go and get your appointment, just go ahead and get vaccinated. That's the only way to defeat this pandemic. Thanks so much for watching. Goodbye.